So I'm just setting up my treatment table for when my partner gets here, and then I'm going to go get some pillows and towels for her to be comfortable and to drape her while we do the treatment. Hi, Miss Bell. How are you doing this afternoon?
I'm good. How about yourself?
I'm good, thank you. I am Akisa Ransall, and I'm a student physical therapist at the University of St. Augustine.
Okay.
If you don't mind, could you give me your full name and your date of birth?
Yes, my name is Deandria Ball. My date of birth is April 11th, 1977.
Okay, thank you. So I understand you're here today because you've been having some back pain for the past couple of weeks.
Yeah.
And so we decided the best way to move forward is to do some massage therapy for the next couple of sessions. The benefits of this would be to decrease your muscle tightness and any inflammation you may have going on.
Okay.
Now, because we will be like going into some deep tissues that aren't normally stimulated, you might be a little sore after these sessions.
Okay.
But if you decide that you don't want to do massage therapy, some alternatives could be some heat packs or some stem or anything like that. But I would suggest to go with the massage therapy because that will give you the best overall benefits and see the results the soonest.
Okay.
Like I said, if you decide to do alternative methods, just let me know. Do you have any questions about anything?
No, not right now. Not that I can think of.
Okay, would you like to go ahead with the massage therapy?
Yeah, let's go ahead and do it.
Okay, well, I'll step out the room while you get dressed and I'll meet you on the massage table.
Alrighty.
So before I got started, I made sure she had a pillow under her shins and under her abdomen. And this was just to make sure she wasn't too curved while we gave the massage. I'm also using some cocoa butter. You can use massage oil, massage lotion, but we decided to use cocoa butter just because that's what we preferred. And that'll just help the massage go smooth. It's not too rough. So this stroke is called effleurage, and I make sure to use both my hands. You're just kind of going up and down. You make sure you go medially, which is the inside of the back, and then laterally, which is outside of the back, and also focus on the shoulders. I'm also shifting my body weight to help provide a deeper pressure with the massage. This stroke is called single-handed kneading, and I kind of feel like the Karate Kid and Miss Miyagi telling me to wax on, wax off. But yeah, you just go same thing, medially, laterally, inside the back, outside the back. So now I'm moving from single-handed to double-handed kneading, which gives a little bit more pressure than single-handed kneading. And you just put one hand on top of each other, and then you pull towards yourself for the lateral or the outside of the back, and then you give pressure pushing away from yourself for the medial part of the back. And then I'll go to the other side and do the same thing, pull towards me, pull towards me, pull towards me, and then I'll push away, push away, push away, push away. Now I'm moving to petrissage, where you just kind of grab the tissue and you pass it back and forth between each of your hands. And I make sure not to lift my hands up. I pass it from one hand to the other, like little crab hands or whatever you want to call it. That's how I think about it. So now I'm doing deep stripping, and I call this the little turkey can one because you kind of make a little turkey. I know y'all can't see right here, but you go deep down into the tissue. And because deep stripping is a deeper stroke, we counter it with thumb effleurage just to kind of relieve some of the tension or pressure we just did with the deep stripping. So then I start over and do it on the other side, and then I'll do thumb effleurage back up to the top again. And so the last one is skin rolling, and it's supposed to be not any of the soft tissue or anything. It's just supposed to be the skin. And you're supposed to make a little diamond and push your thumbs and your index fingers together. But I've been having some difficulty with this one because I kind of try to use all my fingers, and I feel like I'm just moonwalking or spider walking on her back. But yeah, like I said, I'm not the best at this one. She's actually pretty good at it. I'll show you guys in a video after this. But yeah, it's supposed to be just the skin. You bring it to yourself and then roll. And so after I finish skin rolling, I'll do one more round of effleurage to kind of just finish out the massage. And then that'll be the end of that.
Miss Ransall. How you doing today?
I'm good, baby. How you doing?
I'm good. Thanks for asking. Just to introduce myself, my name is Deandria Thaw. I'm a student of physical therapist at the University of St. Augustine, the Austin location. Before we get started, could you confirm your date of birth and your name for me, please?
Yes, I was born January 1st, 1952.
I heard you've been having some back pain. So the best form of treatment that I think will be beneficial to you today is that we do some massages. The benefit of the massages would be to loosen up those back muscles a little bit. You know, I know you was feeling a little.
It's been hurting a lot.
Yeah, we don't want you to hurt. So it'll be very, beneficial if we do some of those massages to loosen up that tension, as well as you feel overall better about your back. Yeah, you know. Now some things that can be of detrimental, I guess, to you. I mean, that's a huge word, right?
Detrimental.
But you know, some negative effects. I think that's a better word. Some negatives to doing the massages would be that you would have some muscle soreness, and as well as once you get off the massage table, you might feel a little dizziness or nauseousness.
That's not too bad.
But yeah, it's not too bad at all. But some alternatives that we could do is maybe have you do e-stim or have you a hot pack.
A hot pack? You gonna give me a hot pack?
Yeah.
Oh, you get to take it home with me?
No,
so nice.
You can't take it home. You can't take it home, but you know, we can give you a hot pack.
Oh, well, I want to do what's already included in my insurance.
Benefit of having the massage overall will be the best treatment for you because we're trying to get those muscles in your back loosened up. We're trying to get you, you know, you want to go back home, see your grandkids and everything.
Pick them up.
So
without my back popping and locking and dropping.
Like I said, it's very beneficial if we just go ahead and do the massages today, and then we'll do the massages over the course of the weeks. But do you have any questions?
No, I don't think I have any questions.
Okay, so did you want to go ahead and do the massages today?
Yeah, let's go ahead and get started. Get this massage.
Okay, well, I'm going to exit the room, and then I'll need you to undress from the top. From the top up.
Oh.
And then I'll be back.
Okay. All right, my massage.
Miss Ransall, can you put your pants on?
You said
Waist up.
So my partner is doing the exact same sequence that I did, so I'm not going to go through all of the thingies again. For class, we either wear a swimsuit or a sports bra that can be like unhooked so that we can easily access our full area. We don't ever do massages or anything over clothing, but depending on the clinic or something, you probably remove all of your clothing and they will give you something to cover up with. And so right here, my partner is doing skin rolling. I'll slow it down right here so that you guys can like actually see what it's supposed to look like. Like I said, I'm not the best at it, but she does it a lot better than me. And it feels like she knows what she's doing too. Hi, Ms. Thaw. How are you doing this afternoon?
I'm good. How about yourself?
Good, thank you. My name is Akisa Ransall. I'm a student physical therapist at the University of St. Augustine. And we're going to check your vital signs, so your heart rate and your blood pressure right quick.
Okay.
We're here today just because you're going to do some physical therapy with us, but we just kind of want to get your baselines for all your vitals so we know if anything goes wrong, we know what the norm is for you and what to watch out for.
Okay. Sounds good.
Benefits of this is, like I said, just knowing what your norm is. So then once we get into the exercise, if anything goes wrong, we can kind of compare it to what your start is and kind of get ahead of everything.
Okay.
Do you have any questions?
No, I don't have any questions.
Okay. Are you okay with me checking your heart rate and your blood pressure?
Yeah, of course.
All right,
go
let's
ahead.
get started. So I counted her pulse to be 34 and 30 seconds. So her actual heart rate per minute is 68, which is in the average range. Her respiratory rate was 7, and times 2, that's 14, which falls in the range. Next, I used the blood pressure cuff to find her occlusion point, which you find her heart rate, and then you pump the blood pressure cuff until you no longer feel the heart rate. That allows you to see where her blood pressure is normally, and that helps you to see when you should expect her blood pressure to come back with the stethoscope.